Hello, I'm Santu Liliana Elena, senior lecturer at Ovidius University of Constanța, medical doctor at Balneal and Rehabilitation Sanatorium Techirghiol, and I want to thank the organizers for the opportunity to present at this congress the paper entitled The Influence of Low Back Pain on Health, related quality of life in actual society and its social, demographic, and clinical determinants. The orthopedic section of the American Physical Therapy Association has an ongoing effort to create evidence-based practice guidelines for orthopedic physical therapy management of patients with musculoskeletal impairments described in the World Health Organization's International Classification of Functioning, Disability, and Health. Low back pain is a very common symptom. It occurs in high, middle, and low-income countries and all age groups from children to the elderly population. Globally, years lived with disability caused by low back pain increased by 54% between 1990 and 2015, mainly because of population increase and aging, with the biggest increase seen in low and middle income countries. Low back pain is now the leading cause of disability worldwide. The Oswald Street Disability Index has been developed to assess pain-related disability in people with acute, subacute, or chronic low back pain. Since it was first published in 1980, several different versions have been developed. The ODI covers one item on pain and 9 items on activities of daily living: personal care, lifting, walking, sitting, standing, sleeping, sex and social life, and traveling. Total 10 items. Content and face validity. The ODI has adequate content validity as it covers activities of daily living that are commonly experienced by patients with back pain. However, it lacks generic activities such as work, leisure, recreation, or sporting activities. The ODA has high internal consistency. It correlates with other measures of disability, such as the Roland Morris Disability Questionnaire, and shows moderate correlation with pain scales and short form. Administration of the Oswald Street Disability Index Questionnaire over the phone has excellent test-retest reliability when compared to face-to-face administration. Telephone administration is a convenient and reliable option for obtaining follow-up outcomes data. Telephonic administration of the ODA is scientifically valid and should be an accepted method of data collection for state-level and national-level outcomes projects. The functional independence measure score is just one of many tools that clinicians can use to determine independence or amount of assistance needed in a rehabilitation setting as well as after discharge. The FIM score was also developed to offer a uniform system of measurement for disability based on the International Classification of Impairment, Disabilities, and Handicaps. The Functional Independence Measure Score assesses 6 areas of function: self-care, sphincter control, transfers, locomotion, communication, and social cognition, which fall under 2 domains: motor and cognitive. It has been tested for use in patients with stroke, traumatic brain injury, spinal cord injury, multiple sclerosis, and elderly individuals undergoing inpatient rehabilitation, and has been used with children as young as 7 years old. The FIM score consists of 18 items assessing 6 areas of function. The items fall into 2 domains: motor 13 items and cognitive 5 items. The motor items are based on the items of the Bartle index. These domains are referred to as the motor functional independence measurement and the cognitive FIM. Low back pain has a direct and proportional impact on function and the general one on the quality of life. The present study aims to evaluate the functional impact of low back pain using specific self-assessment tools as indexes of appreciation and the epidemiological correlation of potential risk factors involved. The conceptual model of outreach is based on the importance of correlating symptoms with clinical assessment using scales of pain, disability, quality of life, and determination of epidemiological correlation of these areas and the determined factors of the pathology. The study groups is made up of 106 cases with clinical diagnostic of low back pain admitted from September 2020 to March 2021 at Balneal and Rehabilitation Sanatorium Technical. After performing anamnesis, general clinical examination, specific neuromusculoskeletal examination, the patients filled the survey highlighting the impact of their low back pain on functionality and disability deriving from it. The survey included the Oswestry Disability Index, the Functional Independence Measure Score, and the Visual Analog Scale Score, evaluated at the moment of hospitalization and at discharge. Statistical analysis of data was carried out and the correlation between variables resulting from study were highlighted. The study was conducted according to the norm of deontology and medical ethics. The authors declare no conflict of interest. Lumbar pathology is common in patients who are hospitalized for a complex balneal physical kinetic treatment at Balneal and Rehabilitation Sanatorium Technical. The majority of patients are females, representing about 57% of the total number. Regarding the patient's age, about 60% of them were in the 50 to 70 years interval. Regarding the urban or rural distribution, about 74% of the patients were from urban areas, perhaps also due to the easier accessibility to medical services in general. The study reveals the major positive impact of our treatment on spinal symptomatology, an effect pointed out by the relevance in statistical differences between the admittance and discharge VAS scores. Admission VAS scores were higher than discharge VAS scores. Reporting the investigated disability with the OSO3 questionnaire of painful lumbar syndrome and functional evaluation scale demonstrates the impact of this pathology on the patient's social life, once again emphasizing the special attention to be paid to axial pathology both as curative treatment and the importance of prophylactic treatment. Statistical analysis of identified risk factors reveals the importance of prophylaxis and patient education in this area. A strong and important statistical correlation was found between the OSO3 total score and the walking and standing items and a moderate but strong correlation with the other items. Regarding the sex life item, the correlation is existent but at modest level, according to the correlation coefficients shown by the statistical analysis. In this slide, you can see the significant differences between the OSO3 scores corresponding to the three group of working item. There are significant differences between the OSO3 scores corresponding to the three groups of clinostatism item. As you can see in the box plot representation of OSO3 questionnaire total score distribution and standing item are significant differences between the scores and this item. There are significant differences between median OSO3 values corresponding to the two-group sleep item. There are significant differences between median OSO3 values corresponding to the two groups of item sexual life. As I said, there is a correlation, but at a modest level according to Spearman's ratio. Box plot representation of OSO3 questionnaire total score distribution and social life shows that are significant differences between the values of the score and this item. In this statistical chart are significant differences between median OSO3 values corresponding to the two groups of item travels. The item pain intensity was statistically investigated, and the result is that exist significant differences between OSO3 values corresponding to this item. The study reveals the importance of correlation of the data obtained clinical exam with self-assessment tools that determine the level of functional independence and the functional impact on social life. It is necessary to quantify the therapeutic result obtained in order to assess the level of improvement in quality of life. Low back pain is the second leading cause of disability in the world. The level of disability in patients with this pathology is an important outcome measure for clinical practice and research. The OSO3 Disability Index is one of the most commonly used scales that assess the disability related to low back pain. I want to thank you for your kindly attention, but not before congratulating all my colleagues for the way they conducted their work during this difficult pandemic period, and for the way they made our specialty regains its true importance among the other medical specialties like Phoenix bird that associated with the sun obtain new life for arising from own ashes. Thank you for your attention.